Most veterinarians, including oncologists, know and have recognized that there's so many similarities between cancer in dogs and cancer in people, and that we can learn from how to treat cancer in people to be better at treating our patients as well. There's a lot that we can learn about breast cancer in the dog that potentially can apply to breast cancer in people. And that's really how I started the shelter program here at Penn. People spay their dog at an early age, and if you do that, you remove the hormones, and by doing so, you reduce the risk for developing mammary cancer. There is a large population of dogs out there. Those are the homeless dogs that are in shelters. Those dogs are not spayed, and many of them develop mammary gland tumors. And if they do so, it's very difficult for those dogs to make it out of the shelters. This program basically combined two things. We save these dogs' lives, we get them in here to the vet school, and we give them the surgery that they need to survive. And by doing so, we can access their tumor tissues and their clinical data, and they become adaptable. We save dogs, which is what we all want to do as veterinarians. And we also do some pretty cool research which enables us to answer some of the questions about how tumor develops and how tumor progresses. And we can take that information then and compare it to what we know about women with breast cancer and hopefully find something that can be useful for both species.
So osteosarcoma is a very aggressive cancer of the bone. It tends to affect large and giant breed dogs, usually older, middle to older aged dogs, and it usually affects bones of what we call the appendicular skeleton, which are in fact the limbs, the long bones. Now, the treatment of choice for these patients, the standard of care, is to actually amputate the leg and then to follow up with chemotherapy. And the reason to follow up with chemotherapy is to try and go after those cancer cells that remain in the body. The metastatic disease is the real problem because you can cut out the primary tumor, but the metastatic disease is really what kills our patients. The immune system lends itself very well to trying to go after these malignant cells. One way that we are looking at doing that is to use a bacteria called Listeria monocytogenes. We're using the genetically modified bacteria to express a piece, if you like, of the tumor, a molecule called HER2/neu. And this is a molecule that is expressed on a number of different cancers. So we use the Listeria to sort of kickstart the immune system. So the idea is that if we give this immunotherapy after standard of care, after amputation and after chemotherapy, and then give them the immunotherapy, that will help to mop up the remaining cancer cells in the body, eliminate them, and therefore hopefully that will translate into a prolonged overall survival and ideally failure of these patients to develop metastatic disease. Unfortunately, osteosarcoma in people tends to be a pediatric cancer, so it tends to actually affect children about 10 to 25 years of age. The concept of basically taking something which I think we have some very compelling evidence shows that it prevents metastatic disease in dogs with osteosarcoma, to then be able to take that and spin it over into the pediatric clinic and to take children with osteosarcoma and treat them with this vaccine and see similar compelling results would be fabulous.